After 60, the very medications you take every day to stay healthy could be slowly destroying your kidneys. I know that's hard to hear, but for millions of older adults, it's already happening and they don't even know it. Some of the most commonly prescribed drugs for seniors like pain relievers, blood pressure pills, and even heartburn medications can silently damage your kidneys over time, especially after age 60. You see, your kidneys are your body's natural filters. They clean your blood, flush out toxins, and keep your fluid levels balanced. But as we get older, these filters become more fragile, and the medications we've relied on for years may start doing more harm than good without warning. According to the National Institute on Aging, more than 37% of adults over 65 have chronic kidney disease. Most don't even realize it until it's serious. Harvard Health warns that prescription medications are one of the leading contributors to kidney decline in older adults, especially when combined with dehydration or long-term use. In this video, I'm going to walk you through 7 medications that can quietly destroy your kidneys after 60. And I'm not just speaking as a health educator. One of these drugs actually harmed my own kidneys. I took it, I trusted it, and I learned the hard way. I'll share what happened to me and how you can avoid the same mistake. So please watch until the end, because the medication that affected me might be in your cabinet right now too. Before we begin, make sure to subscribe to my channel, Golden Aging Health, give this video a like, and turn on the notification bell so you never miss important kidney and medication tips made just for adults over 60. Medication number 7. Lithium. My old neighbor Joe, who always seemed sharp and in control, took lithium for over 12 years to manage his bipolar disorder. He never missed a dose. He kept every appointment, but what he didn't know, the lithium was slowly damaging his kidneys the whole time. It started with frequent nighttime bathroom trips, then constant thirst. By the time his lab tests showed something was wrong, he had already entered stage 3 chronic kidney disease, and no one had warned him this could happen. Lithium is a powerful medication, often used for bipolar disorder and mood stabilization, but long-term use can seriously affect kidney health after 60. It interferes with the kidney's ability to manage water and sodium, which can lead to a condition called nephrogenic diabetes insipidus, and eventually permanent kidney damage or even end-stage renal disease. According to the Journal of the American Society of Nephrology, up to 40% of long-term lithium users experience decreased kidney function often, without obvious symptoms. If you or someone you love is on lithium, don't wait. Regular blood tests to monitor lithium levels and kidney function are essential. Drink fluids consistently and avoid sudden changes in salt intake. They can throw your entire balance off. Right now, I want you to do one thing. Open your medicine cabinet. Take a closer look at the labels. Do you see lithium listed on any of your pill bottles? If so, it's time to pay extra attention. And even if you don't stay with me, we've still got 6 more medications to cover, and one of them might be sitting right there beside it, quietly doing more harm than good. Medication number 6. Antiviral drugs. After hearing about lithium, some people might think kidney damage only happens from long-term mental health meds. But here's the truth: even short-term medications taken during illness can silently harm your kidneys. Let's talk about antiviral drugs. Medications like Acyclovir, Tenofovir, and Remdesivir are powerful treatments for viral infections like herpes, Hawaii V, and COVID-19. They save lives, but they also come with serious kidney risks, especially for adults over 60. These drugs can form crystals inside the kidney's filtering system, leading to blockage, inflammation, and a condition called acute tubular necrosis of the more severe forms of kidney injury. According to a 2021 article in the Clinical Kidney Journal, antiviral drugs are among the top causes of drug-induced acute kidney damage, especially when patients are dehydrated or already have reduced kidney function. I've met people who took antivirals for just a week and ended up with long-term kidney changes, all because they didn't know the risks or weren't told to stay properly hydrated during treatment. So here's my advice. Only use antiviral medications under close medical supervision. Avoid online purchases and take every dose exactly as directed, with plenty of fluids. So if you've taken antivirals recently, especially without much fluid or follow-up, now's the time to ask your doctor how your kidneys are doing. Up next is a medication class that almost every senior takes daily. It's meant to protect your heart, but if you're not careful, it could quietly harm your kidneys. This one's prescribed more than any other, and it's likely in your pill organizer right now. You won't want to miss it. Medication number 5. ACE inhibitors. If antiviral drugs can harm your kidneys in a matter of days, imagine what long-term medications might be doing, especially ones you've been taking for years. That brings us to ACE inhibitors, like Lisinopril, Enalapril, and Remdesivir. These are among the most common blood pressure drugs for seniors. They're often prescribed to protect the kidneys, especially in those with diabetes or early chronic kidney disease. But there's a catch. ACE inhibitors lower pressure inside the kidney's filtering system. That's helpful in early disease, but when combined with NSAIDs, diuretics, or dehydration, it can backfire. The kidneys may not get enough blood flow to function properly. Mr. Rowland, 72, was on Lisinopril and a water pill. After a bout of food poisoning left him dehydrated, he noticed fatigue and swelling. His blood work revealed a sudden rise in creatinine. He developed acute kidney injury, not from the virus, but from the way his medications interacted during stress. According to the Journal of the American Geriatric Society, nearly 1 in 10 hospitalized seniors with kidney damage were on ACE inhibitors at the time, often with no symptoms beforehand. Have you checked your medicine cabinet yet? After these first 3 medications, are you currently using any of them? Let me know in the comments and share your experience. It might help someone else catch a problem early. Medication number 4. Proton pump inhibitors, PPIs. After hearing about blood pressure meds, you might be thinking, well, I don't take any of those. But here's one that might slip under your radar: proton pump inhibitors, or PPIs. If you've ever taken Omeprazole or Esomeprazole for heartburn or acid reflux, you've used a PPI. Millions of seniors take them daily sometimes, for years believing they're harmless. But the truth is, long-term use can quietly hurt your kidneys. PPIs are designed to reduce stomach acid. They're effective for treating ulcers, acid reflux, and GERD. But studies show that using them beyond 8 to 12 weeks, especially without supervision, can raise the risk of chronic kidney disease, often without symptoms. One of the biggest concerns is acute interstitial nephritis, a type of inflammation that damages the kidney tissue over time. According to research published in the Journal of the American Society of Nephrology, PPI users had a 20–50% higher risk of developing kidney disease, especially when taken daily without breaks. Mrs. Darlene, 70, had been on Omeprazole just to be safe. She felt fine until labs showed elevated creatinine. Her doctor immediately stopped the PPI, and her kidney numbers stabilized over a few months. So, if you're taking a PPI, don't panic, but ask your doctor if you still need it. Use it short-term, check your magnesium, and get kidney tests if you've been on it for more than a few weeks. Medication number 3. Diuretics. Have you ever felt lightheaded standing up too quickly? Or noticed muscle cramps, fatigue, or dry mouth but brush them off as aging? It might not be just age. It could be your diuretic. These so-called water pills like furosemide, Lasix, Spironolactone, or hydrochlorothiazide, prescribed to lower blood pressure and remove excess fluid. They're effective, but they also increase urine output, and with it, the loss of vital minerals like potassium, sodium, and magnesium, leading to silent dehydration and kidney stress. A 2021 study from the British Journal of Clinical Pharmacology found that seniors on long-term diuretics had a 32% higher risk of kidney function decline over 2 years, especially when not regularly monitored or during hot weather. I once spoke with a retired bus driver named Leo, 71, who took a low-dose diuretic for his heart. After ignoring subtle signs like cramping and dry skin, he ended up in the ER with acute dehydration. His doctor called it medication-induced kidney fatigue. If you're using a diuretic, the solution isn't to stop suddenly but to check in more often. Ask your doctor about kidney panels, electrolyte levels, and how to safely stay hydrated. And let me know, have you ever experienced these subtle symptoms while on a water pill? Drop a comment and let's discuss. Your story could help someone catch it early. Medication number 2. NSAIDs. Ibuprofen, Naproxen, Aspirin. Most people think kidney damage comes from strong prescription drugs. But what if the real danger is sitting right in your kitchen drawer? NSAIDs like Ibuprofen, Naproxen, and Aspirin are some of the most trusted over-the-counter medications. They're in every household, used for joint pain, headaches, even flu symptoms. They seem harmless, but they're not. This is the medication that personally damaged my kidneys. A few years ago, I started having chronic knee pain. Like many people, I turned to ibuprofen and naproxen, just a couple pills here and there to help me get through the day. Over time, it became part of my routine. I thought I was treating my joints, but what I didn't know was that I was quietly hurting my kidneys. My legs began to swell. I assumed it was joint inflammation, but after blood tests, my doctor told me something I didn't expect. My kidneys were under stress, likely from frequent NSAID use. It was a hard wake-up call. What many people don't know is that NSAIDs quietly reduce blood flow to the kidneys. They block prostaglandin chemicals that help widen kidney blood vessels. Without them, the kidneys can't filter properly, especially if you're also dehydrated, on a diuretic, or over 60. The result? Over time, this can trigger chronic kidney disease, or even acute kidney injury with no obvious symptoms. According to clinical nephrology, older adults who regularly use NSAIDs have a 36% higher risk of kidney function decline, especially when taking them long-term without medical oversight. So don't assume over-the-counter means safe. Use NSAIDs sparingly, stay hydrated, and talk to your doctor if you use them often. And now, we've reached medication number 1, the most prescribed drug in the world, and a surprising threat to kidney health: antibiotics. Medication number 1. Antibiotics. I have a friend named Ruth. She's 67, recently retired, and just wanted to enjoy her time with the grandkids. After a mild sinus infection, she took a few leftover antibiotics she had from a past illness, just to be careful. By the end of the week, she felt dizzy and bloated. Her legs were puffy. And after some routine labs, her doctor gave her a diagnosis she never expected: acute kidney injury, not from the illness, but from the medication. That's why antibiotics top this list of medications that damage kidneys. Careful. Drugs like ciprofloxacin, amoxicillin, vancomycin, and especially aminoglycosides and polymyxins are known to collect in the kidneys and disrupt cell membranes, leading to inflammation and even permanent kidney cell death. According to Harvard Health, kidney damage is one of the most common serious side effects of several broad-spectrum antibiotics, particularly when used repeatedly in short time frames. And FDA adverse event reports have consistently flagged antibiotics, especially IV and high-dose types, as a major cause of drug-induced kidney injury in seniors. So please, never use leftover antibiotics, and don't take them unless your doctor absolutely recommends it. Have you or someone close to you had kidney issues after taking antibiotics? Share your story below. You might help someone avoid a dangerous mistake. So let's recap what we've uncovered today. From mood stabilizers and antibiotics, to painkillers, reflux meds, and blood pressure drugs, many common medications can quietly harm your kidneys, especially after age 60. The damage often happens slowly and silently, without pain, until it's too late. That's why it's so important to stay aware of what you're taking and how it may affect your kidneys over time. You don't need to fear your medications, but you do need to understand them. Talk openly with your doctor. Ask whether your prescriptions require kidney monitoring. Make sure you're staying hydrated, and never self-prescribe or continue medication without medical supervision. Remember, your kidneys may not complain loudly, but they are working hard for you every single day. A little extra care can go a long way in keeping them healthy for years to come. If this video helped you or opened your eyes to something you hadn't considered, subscribe to Golden Aging Health and click the bell so you never miss a tip that could protect your health. And don't stop here, check out our related video. 5 Common Water Drinking Mistakes That Damage Your Kidneys After 60. It's the perfect next step to keep your kidneys strong and supported. Thanks for watching, stay well, and I'll see you in the next one.